Greetings everyone. I'm Dr. Odoch from Radiant Group of Hospitals. I'm a medical officer. The month of October is here and we do commemorate the breast cancer month. So what exactly is breast cancer? We can describe breast cancer in a way that the cells in the breast are growing out of control. So when these cells grow out of control, definitely other symptoms and signs will come in. So we all have a clue of what breast cancer can do, because breast cancer is the most common cancer in women. It is responsible for almost 25% of all cancers in women. And we know that it has about 14% mortality, meaning that of those that have breast cancer, about 14% will end up dying because of the cancer. And this is majorly common in developing countries where we do lie, especially African countries, majorly because of late detection of breast cancer. So looking at the awareness, our main target is to increase the awareness of breast cancer, early detection, so that we can handle a lot of this. So what causes breast cancer? Like many cancers, the exact cause is not known, but there are several factors, what we call risk factors, that can lead us to breast cancer. There are the unmodifiable ones, where gender falls in. Being female is already a big risk. But it's important to note that even men can get breast cancer. Family history of breast cancer is already a big risk for you. And then personal history. For example, you got breast cancer on the right breast 5 years ago, you stand a high risk of getting breast cancer in the other breast. Then age is also a factor. We have noticed that women between 40 to 50 years are more predisposed to getting breast cancer. There are also lifestyle risk factors that we have. Intake of alcohol, smoking. We look at overweight, what we call obesity, high fat diet, and then physical inactivity. We are always emphasizing change of lifestyle when it comes to non-communicable diseases. Breast cancer is not left out. And then there are other things which are still controversial, especially hormonal replacement therapy, oral contraceptive pills which are hormonal. These are a little contradicting in one way or the other. Then there are other environmental factors, for example, exposure to irradiation. Irradiation, we are meaning things like rays, X-rays, and all those. So we have a clue of the risk factors to breast cancer. So what are the signs and symptoms that will tell us that this is breast cancer and this is not breast cancer? Remember, as a patient, when a sign pops up, that will trigger you to visit a hospital. So what are these signs? What are these symptoms? We shall start with the skin symptoms and signs. We look at skin dimpling. We all have a clue what dimpling is. Those are little notches in the skin. We can see redness of the skin that is persistent over a long period of time. And then surface ulceration. You get small wounds on the skin of the breast, and then it's persistent. It's not something that will come 1-2 days and disappears. Then there are also changes to the nipple. So you find that probably there's nipple discharge. It can be bloody, it can be clear, it can be greenish, it can be milky. Putting into consideration that probably at that time you're not breastfeeding, or at that time you're not pregnant, and these discharges, especially the bloody ones, persist over a period of time. Apart from the discharges, we can also have ulcerations or rashes involving the nipple or the areola. The areola is the area around the nipple, that darker area around the nipple. So you find that these rashes persist over time, and most times it is on one side of the breast. So apart from that, we look at other factors. For example, you find that you have a lump in your breast. It could be hard, it's painless, and this is a lump that probably is increasing in size over time. So how are we going to identify that you have a lump? This is where self-breast examination comes in. We are going to show you this, and it's important that at least once every month, every woman self-examines her breast, because once you elicit this lump, once you look at these ulcerations, once you notice these discharges, this will be a trigger for you to go to visit the hospital. And now when you get to hospital, this is where now us as the clinicians, the doctors on ground, the nurses on ground, will now pick up and find out what exactly is happening. So to confirm breast cancer, there are processes that we shall take, which will involve our clinical examination as doctors and nurses. If we pick up anything that is suspicious, then probably we can do some tests, which will involve radiological assessment. This is where we can do an ultrasound of the breast, especially if you are below 35 years. And then if you are 35 years and above, we can do what we call a mammogram. So why the age difference? Because you find that a mammogram, which is very specific to pick out breast cancer, the specificity reduces, especially if you are younger than 35 because of the tissue. You know, the breast tissue is still a lot below 35, so it reduces the specificity of the mammogram. Besides that, when we find something suspicious as doctors, we'll always tell you, probably there's something here. We can pick a biopsy. A needle is probably passed into the breast. A sample is taken and taken to the laboratory to confirm if this is cancer or not. So we have looked at this. You have come to hospital. We have examined you. We have done our assessments, and we have confirmed this breast cancer. What next after that? If it is detected early, there is treatment. Even though it's detected late, yes, there is still treatment. The earlier it is detected, surgery can be done, okay? And there are two ways the surgery can be done. It can either be what we call total mastectomy, where the entire breast mass is removed, including lymph nodes in the armpits. And apart from that, we can also do what we call lumpectomy. If we have found out that there is a lump in the breast, the lump is removed with some tissue of the breast. Then later, you have what we call radiotherapy, which is the other mode of treatment, where we use X-rays to kill the cancer cells. Besides that, we can also use chemotherapy. Chemotherapy, where we give you medicines. It can be medicines through the vein or medicines which are taken orally to enable the cancer cells to regress, because these medicines kill the cancer cells. Like I said earlier, the earlier it is detected that this is cancer, the easier for the cancer to be treated. Unfortunately, if it is detected late, which is a very common practice, especially in developing countries, then you find that most times the patient will end up in palliative care. There are several palliative care centers which have cropped up and are doing very good service to patients who cannot be treated by radiation, by chemotherapy, or by surgery. So we have looked at the treatment, but there's one thing that we normally forget as doctors, as nurses, as everyone in the medical field: the psychological approach to breast cancer. Imagine someone is confirmed to have breast cancer. How do we handle them psychologically? Because you know it is going to be depressing. and it involves a lot of use of finance. So you find that a lot of money that is saved and other resources have to be used. With time, it will run out. So we always have to prepare our patients psychologically, emotionally, and that is where the psychotherapy team will come in to always counsel the patient. It can be individual counseling or group counseling, family counseling, because this is something new. How are we going to handle it from here forward? Because it's not a one-day process, it takes time. So we always remember to support each other in times like this. So after looking at all this, is there a way we can prevent breast cancer? Yes, there are various ways we can prevent breast cancer. We already looked at the risk factors. One of them, we talked about high-fat diet. So we need to reduce fat in our diet. Why fat? Breast cancer will flourish if there is a lot of estrogen in the bloodstream. And remember, fat is needed for production of estrogen. So the nutritionist will come in. High fiber diet. Fiber reduces absorption of fat. Fiber will help the amount of estrogen which could be made, because definitely if fat absorption is reduced, then we can reduce what? The risk of breast cancer. We talked about physical inactivity. Let us ensure we get active. Physical exercise, something that makes you sweat, something that is enjoyable. Besides that, we always say cut down on alcohol use, cut down on smoking, okay? And then other lifestyle modification, okay? Especially improper use of hormonal therapy. Some of us these days go over the counter and access hormonal replacement and all this. Always access a hospital so that we cut down on this risk. So we have looked at this, what breast cancer is, the causes, including the risk factors, what are the signs and symptoms, the psychological approach to managing a patient with breast cancer, and then the prevention. I hope this was helpful. Thank you so much for listening to me today, and I hope we can always try our level best to beat breast cancer and to help those who are suffering from this to get better care.